Hi, I'm Dr. Madsen. Today we're covering Chapter 4, following the OpenStax textbook, Population Health for Nurses, and this is covering the health of the population. So today we're going to define health and talk about performance metrics. We're going to also cover health in America, the World Health Statistics, and global public health security. So by the time you're done with this lecture, you should be able to discuss different meanings of health and formulate a definition of health and explain the purpose of measuring health outcomes in a population. So the World Health Organization, their definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of infirmity. When we're talking about social determinants of health, these are the conditions in the environment where people are born, live, learn, work, play, worship, and age, and that affects a wide range of health, functioning, and quality of life outcomes and risks. So what does it mean to be healthy? This is a conversation that needs to happen because it depends on an individual's definition of health. So those who perceive health as complete physical well-being may see themselves as unhealthy if they have a chronic illness like asthma. Some with a holistic view of health may feel healthy even with a chronic condition, and others see it as well-being. So that's subjective perspective that their life is going well. There's also health-related quality of life, and that's the perceived physical and mental well-being of an individual or population that can be measured using a variety of surveys and scales. So a change in health status of this can be an individual, group, or population is tied to a particular intervention or series of interventions. So population health outcomes look at broad topics related to a target population. For example, we could look at mortality rates. So now, by the end of this next section, you should be able to explain the purpose of health indicators and identify approaches to measuring population health outcomes and be able to differentiate between various types of health status indicators, and also discuss the nurse's role in managing population health. So health indicators, these are health-related measures of data. This is referring to a health status. And years of life lost are measures of premature mortality. So this is considering the frequency of death and age at which it occurs. And then years of healthy life lost due to a disability. This is the number of healthy years lost because of the onset of a disability or illness. And disability adjusted life years, or DALYs, is the sum of years of life lost and years of life with a disability attributed to a disease. So each DALY represents the loss of 1 year of full health. And quality adjusted life years, that looks at months or years of reasonable quality of life of an individual can gain following treatment. And these indicators are typically used in research to measure not just the mortality and morbidity rates, but also how health is impacting a population in other metric systems. So the measurement of population health, so life expectancy at birth, this is the overall mortality level or average age of death. In morbidity and mortality, this is looking at progression and severity of a given health event. So specifically, morbidity is the state of being symptomatic due to a disease. And then the prevalence measures to the proportion of a population that has a disease or condition over time. So how many people have this disease or condition over time? And that's different than incidence, which is looking at specifically the new onset of disease. And then mortality is the number of deaths in each time frame. And then when we're looking at burden of disease, this is measuring both indicators together. So we're then now looking at both of these. And then when we think about the summary measures of population health, we're combining data from these basic metrics to represent health in a single number. So these are typically measured within research studies, and this is helping us understand the state of well-being in our nation and globally. So here what we're looking at is the burden of disease in the world, and the total disease burden here, we're looking at the disability adjusted life years by subcategory of disease or injury. So you can see the DALY is measuring the total burden of disease, both from years of life lost due to premature death and the years with a disability. And like we said, one DALY equals 1 year of life lost. So you can look at this from cardiovascular disease to cancers to neonatal disorders. And this is looking at the aggregated data within the world. And before the COVID-19 pandemic, cardiovascular disease was the #1 health burden in terms of years of life lost. And we can now see how this is changing based on different burdens of disease that are impacting us throughout the years. So this was from 2019. There are more current burden of disease in the world as these statistics change over time. So key health indicators are based on subjective data. So when we're looking at the behavioral risk factor surveillance system, this is a health-related telephone survey. And then the National Health and Nutrition Examination Survey, this is combining interviews with the physical examination to assess nutritional health. So these surveys you'll see a lot of times in the research to measure these different metrics. And then the National Health Interview Survey, this is the oldest ongoing health survey in the United States. And then the health-related quality of life, so the CDC survey is using a subset of questions called Healthy Day Measures. So what's the role of the nurse within this? So the nurse's role in managing population health, they're well positioned to identify patterns across populations. This makes us as nurses very impactful in research. On a basic level, nurses should understand health metrics, population health outcomes, and key health indicators. When in the community, nurses can improve health for populations at large. So for this next section, you're going to be looking and being able to identify health priorities in the United States, discuss the leading cause of death in the United States, and describe trends in mortality due to the most common infectious and chronic diseases across populations, and discuss health trends in the United States. So here you should also be able to compare health outcomes, and in the lens of all of this information, we're constantly thinking about what the nurse's role is in addressing this. To start off, we're going to talk about Healthy People 2030. So this, in the United States, the mission of Healthy People 2030 is to support the nation's effort to improve population health and well-being, and this is to help promote healthcare across the nation. And the idea is to create physical, social, and economic environments and really propose effective policies that will promote health for all the different populations within the United States. So the vision is a society in which all people can achieve their full potential for health and well-being. And the overall health and well-being measures, so there are 8 broad and global outcomes which are measured to assess this Healthy People 2030 vision. And from there are core objectives. And all of these you can see on the Healthy People 2030 website. But there are 359 measurable public health objectives. And these each have a 10-year target with an associated evidence-based intervention. So these health indicators, there's a small subset of 23 high-priority Healthy People 2030 core objectives. And these are targeted to really drive change and well-being in these focused areas. For the developmental objectives, these are public health issues with evidence-based interventions, but they're really lacking reliable data. So if you go on the website, you will see these as developing. And then the research objectives, so researchers will use Healthy People 2030 and try to look at public health issues that are not yet associated with evidence-based interventions. So trying to identify and find interventions to decrease that gap. So leading causes of death in the United States, according to the National Center for Health Statistics 2023. So heart disease was number one, then cancer and COVID-19. Accidents, so unintentional injuries, a lot of times this would be car accidents. Stroke, chronic lower respiratory disease, Alzheimer's, diabetes, chronic liver disease and cirrhosis, nephritis, nephrotic syndrome, and nephrosis. So when we're thinking about trends in mortality, so over the past century, life expectancy has increased and rates of death have decreased. So the 20th century saw an unprecedented decline in mortality, and life expectancy rose by more than 30 years during that time frame. And then infectious diseases were the leading cause of death in the early 1900s, and we saw improvements in sanitation and nutrition and the development of antibiotics, and all of these led to a sharp decline in deaths from infectious diseases. Chronic diseases then emerged as the primary cause of mortality. And then following decades of increases in life expectancy in the United States is now falling again. When we think of mortality trends in infectious disease, so infectious disease we can see through COVID-19, they still remain a public health threat in the United States. Americans of all ages are at risk for mortality for other infectious diseases. We can see this with bacterial sepsis in newborns or influenza and pneumonia for people from 1 year through adulthood. Mortality trends in chronic disease. So when we talk about chronic disease, this is a condition that has been present for more than 1 year and requires medical intervention. There are 6 out of 10 Americans that have one chronic disease, and 4 in 10 have 2 or more. Major chronic diseases are heart disease and stroke, diabetes and cancer, and chronic disease accounts for most healthcare costs in the United States. Suicide is death caused by self or directed injurious behavior or an intent to die. The rates increased by 37% between the years of 2000 and 2018, and then decreased by 5% between 2018 and 2020. So research indicates that increased suicide rate correlates to increase in mood and affective disorders and are associated with alcohol and drug use. So drug overdose can be intentional or unintentional. In the United States, currently, there is an opioid overdose epidemic. When we look at trends in maternal and newborn mortality, so pregnancy-associated deaths are those occurring during pregnancy or within a year after the end of pregnancy, whatever the cause. And then pregnancy-related deaths can occur either during pregnancy or within a year after the end of pregnancy, which is really important because this is where the gap is happening in a lot of the higher mortality rates in maternal health, and it's understudied and really not understood well. Maternal mortality refers to deaths that occur while pregnant or within 42 days after the end of pregnancy from any cause or aggregated by the pregnancy or its management. And the maternal mortality rate in the United States exceeds that of any other high-income country, and it's growing. And it's disproportionate when we look at it within groups. So when we look at race and ethnicity, there's a huge disparity there. Infant mortality refers to an infant's death before the first birthday, and the U.S. rate exceeds that of its peer countries. Some research indicates this is related to the premature births that are occurring. The rates and the treatment that is available to allow for those births to happen. So research in this area is important to continue understanding this. And then infants born to Black people in the United States are higher risk of mortality than those born to white people, and this is exceptionally high. When we look at healthcare disparities, there are various factors that are responsible, and disparities exist along many dimensions. So race, ethnicity, sexual orientation, age, socioeconomic status, and geographical location. And this can happen for a number of reasons. Some research indicates this is lack of insurance or transportation, cultural differences between providers and patients. So some positive trends, health trends in the United States. So we see that heart disease rates are decreasing. The percentage of children with asthma is also declining. In 2019, smoking declined from 20.6, smoking declined from 20.6% in 2009 to 14.2 in 2019. But there's more research needed in this area to then see if that is different from vaping. So there's definitely more research needed there. And then uninsured Americans under 65, that has decreased, although it's still 12%. And there's a delay. The delay in seeking medical care has also been decreasing. So some negative health trends in the United States. So rural residents are at a greater risk for poor health than those of their urban counterparts, and many indicator measurements are worse in rural versus urban areas. And then suicide rates have increased in almost every state over the last 2 decades. When we're looking at this comparison between the United States and other high-income countries, spending on healthcare and medical technology is higher in the United States than other incomes. Other high-income countries in the U.S. has poor health outcomes and the lowest life expectancy compared to its peer countries. When we think about the nurse's role in addressing inequities, so nurses have a professional and moral responsibility to address healthcare inequities embedded in the U.S. healthcare system, and they're uniquely qualified to do this because they're accustomed to navigating the healthcare system and can help patients navigate the healthcare system. When they work in population health, nurses can work as case managers, and this is important to connect to resources. They also can act in public policy and advocate for improved access of care and extend to many other areas of health. For this next section, you should be able to discuss the Sustainable Development Goals, also talk about the global burden of disease and be able to quantify global health priorities, examine global disease estimates to develop an understanding of global health challenges, and recognize how health in the United States intersects with global health, and describes the nurse's role in global health. So there are 5 sustainable development goals, and they're organized, not 5 goals. These are organized into 5 categories. So people, planet, prosperity, peace, and partnership. And essentially, these sustainable development goals are a 15-year plan with 17 interlocking goals that are a call for action. They address poverty, inequality, climate change, peace, and justice. They're aimed at all countries, including those that are developed and those that are developing. And then they are grouped into these 5 different categories. So the Global Burden of Disease study is a resource that looks at changing healthcare needs and challenges worldwide in the 21st century. So key findings in 2019 are the health of the world's population, and that could be looking at life expectancy, looking and addressing urgent needs about chronic diseases and risk factors, and trends in maternal and child health. Also looking at the impact of COVID-19 pandemic and the relationship between climate change and health. And then top priorities, and we could see this through the mortality rates to cardiovascular disease, diabetes, cancer, and then also malaria. So there's research. Research is so important. Nurses are positioned to be key leaders and investigators in research studies and in interdisciplinary groups, and to study the interventions to prevent or limit the spread of disease. So here in particular, this is for malaria, and the U.S. Army medical researchers are taking part in World Malaria Day, and this is from 2010. So here we're going to talk about how global disease estimates support challenges. So we're going to be identifying health priorities and looking at mortality and disability throughout the world, and also be thinking about this in terms of prevalence and relative harm that these conditions cause. Some statistics. So when we think about the intersection of health in America with global health, this is historically the U.S. has engaged with global health activities for over a century. And it has historically, and this has changed, contributed more funds to international health programs than any other countries. Don't know what those statistics are now. Those will probably be developing, and we'll need to look at that. This also protects the health of and well-being of Americans, as well as those globally. And health and safety of countries worldwide are closely linked than they ever were before. We saw this during the COVID-19 pandemic. So countries need to collaborate to share best practices and strengthen global health and human systems. We see this beautifully orchestrated in international nursing conferences, where there is this thought exchange and collaboration. So the nurse's role in global health, there's a professional obligation to understand global health issues and health priorities. So you're doing part of this, fulfilling part of this obligation by informing yourself now and getting this foundation in place. And it's really important for nurses to develop this understanding of these SDGs and the global health priorities and where they're coming from. So that foundational knowledge. All nurses must support health promotion initiatives to improve health outcomes. So this next section, we're going to talk about global health security, describe interventions to promote health security, public health security, and interconnectedness of population health borders, and then think about the nurse's role in public health security. So global health security risks, emergence and spread of new infectious diseases. So this is the ability of diseases to spread related to increased globalization of travel and trade. So people are traveling more than they ever have before and have the ability to do that. But with that comes this spread of disease that was never able to spread as rapidly. So there's also an increasing drug-resistant disease causing pathogens, risk of accidental release, theft, or unlawful use of dangerous pathogens. The Global Health Security Agenda is an effort of more than 70 countries to protect the world from infectious disease threats. So the surveillance system, this is identifying risks. It's used to quickly detect and stop outbreaks of infectious disease. The laboratory systems are used to do the detection of pathogens. The emergency management and response, this is important public health security interventions, the study and implementation of those. And then the workforce development, this is where every country should have really well-trained, highly skilled teams to investigate potential outbreaks and intervene quickly. The CDC has established the field epidemiology training program to train these disease detectives. When we think about the interconnectedness of health across boundaries, so Ebola, the first outbreak occurred in 1976 in the Democratic Republic of the Congo near the Ebola River. So more than 20 outbreaks in 18 countries occurred. Tuberculosis is found in every country in the world and affects all age groups. It's the second leading cause of infectious disease worldwide. And then the multi-drug resistant TB is resistant to drugs and is easily transmitted. Human immunodeficiency virus was first reported in 1981. It was a major global health issue. ongoing transmission of HIV, with increasing transmissions reported by some countries. And in 2022, 40 million people were living with HIV. So nurses have a vital role with active participation. This includes writing, updating, reviewing, and exercising emergency response plans. They're key collaborators. Nurses may be required to dispense vaccine, antimicrobials, or antitoxins, or obtain other resources from HHS Strategic National Stockpile. Nurses also may assist in shelters, schools, or places with vulnerable populations, and may supply or give psychological support to victims, the public, and workers who are responding or working in a bioterrorism event. So in summary, we talked and defined public health nursing. We looked at all these different aspects of physical, mental, and social well-being for nurses to promote health and prevent disease. When we think about this in terms of public and community health scope and core competencies and functions, so nurses are really working on interprofessional teams in the community and in research areas, and are key for collaboration. Also, they're working to address communicable and non-communicable disease and promote health. Thank you.